Hi everyone, my name is Paige Brigham,
And my name is Katie Kurz.
and we are Maryville University students finishing out our master's program in occupational therapy. We are going to be giving this short presentation talking about occupation-based practice, what it is, why it's important, and how to best use it in a hand therapy clinic. We are giving this presentation in partial fulfillment of our degree focusing on advocacy and promoting occupation-based practice. For this presentation, the following objectives are: define occupation-based practice, discuss the need of OBP in hand therapy, identify potential barriers to OBP, discuss what is being done to facilitate OBP, and identify strategies you can use to do occupation-based treatments. What is occupation-based practice? I'm sure almost everyone knows what occupation-based practice is in using occupations as the means and ends of therapy. This means that the OTP will use meaningful occupations specific to the client as the primary methods of interventions to help their client reach their therapeutic goals. So looking at the pictures on the slide, you can have your treatment session consist of doing laundry, washing dishes, painting, and more. The goal is to get the client back to doing what they need to do, want to do, and are expected to do. This is best done through actually doing the activities and incorporating their meaningful occupations. There are a multitude of benefits to using occupation-based practice. Utilizing this allows clients to engage in their meaningful therapeutic activities unique to each individual, which can then help to promote client participation and buy-in for OT sessions. Allowing the opportunity for the client to use their everyday occupations can help them to maintain positive connections to their important roles, responsibilities, habits, and ADLs. Therefore, this can impact their pleasure, productivity, and restoration for them positively. Additionally, it allows therapists to provide holistic treatment approaches and facilitate functional activity in therapeutic sessions. So why are we talking about occupation-based practice specifically for hand therapy clinics? It has been found in research that some OTs have gone astray from the heart of occupational therapy and have deviated from using occupations during their interventions. We have shifted from using the occupational lens and OBP to a more medical model focusing on person factors and biomechanical body functions. This is not the fault of any practitioner, but merely due to the fact that hand therapy has been rooted in the medical model, focusing on structures and muscles which impact the dysfunction of the hand and upper extremity. This presents challenges when we look at what we as OTs are working to improve for our clients. The root of OT states that independence in occupations should not only be the end goal of therapy, but they should also be used as the means of treatment. This in itself can be to a more holistic treatment which can show others the importance of focusing on occupations, and it also provides a way to evaluate the quality of an individual's occupational performance rather than just focusing on their outcomes. While there are many benefits to using occupation-based practice, there are a variety of barriers to completing and facilitating OBP within hand therapy settings. Research has shown that there are logistical and reimbursement issues, medical limitations and protocols, lack of time, and cost and space restraints. There is also a general lack of understanding of occupation-based interventions, which prevents practitioners from further exploring and utilizing occupations as a treatment modality.
There are currently many steps in the OT world being implemented to help facilitate the use of OBP. These approaches help to address the deviation of using occupations as the means and end to therapy. To start, for an occupational therapy program to become accredited, they have to uphold many specific standards. These standards are set by the Accreditation Council for Occupational Therapy Education, also known as ACOTE, and they focus on the schooling, staffing, students, and their curriculum. There are many ACOTE standards that address using occupations during your interventions, but specifically standards B.4.2 and B.4.3 focus on occupation-based practice. They state that the curriculum should enable students to demonstrate clinical reasoning to evaluate, analyze, diagnose, and provide occupation-based interventions to address client factors, performance patterns, and performance skills. They also state that They should utilize clinical reasoning to facilitate occupation-based interventions that address client factors. This must include interventions focused on promotion, compensation, adaptation, and prevention. Having students learn the importance of occupation-based treatment while in school will encourage and facilitate the use of it once they enter the OT field. This will then push the clinicians in hand therapy clinics and other settings to adopt this method as well. Beyond education standards, there are additional strategies that occupational therapists can utilize to become more occupation-focused and occupation-based. Taking opportunities in small steps to support and encourage this practice will highlight the uniqueness of our profession. Among these strategies, therapists could create dialogue about occupation, attend and contribute to professional development events that focus on OT, commit to educating students as a means of learning new ideas, reframe work activities to think and act in more occupation-based ways, remain current with research on occupation-based practice, contribute to professional work, and participate in continuing education. Additionally, other areas of OT, such as skilled nursing facilities, are working to overcome barriers and remain occupation-centered in interventions. For example, some strategies would include using AOTA's occupational profile template to gather important and relevant information about the person, their occupations, contextual factors, and more. Use of the occupation-centered intervention assessment would allow practitioners to reflect on intervention methods and brainstorm ways to implement more occupation-centered interventions. Looking at current CPT codes for billing could also be an important step to add more occupation-centered interventions, such as self-care skills rather than only therapeutic exercise. With this, documentation should reflect occupational therapy's distinct value and skills to address functional independence for insurance. Lastly, one may advocate for occupational therapy's roles in setting and the value of occupation-centered practice to other employees and employers. State and national level advocacy for policy change is also an option. What does OBP look like in a hand therapy clinic? While it can be easy to shift your focus to therapeutic exercises and preparatory activities focusing on the client's deficits, it's important to bring back occupations into the picture. Finding a balance between the value of occupations as well as a biomechanical principle is vital in achieving the client's therapeutic goals. There are many tools and strategies available to help practitioners remain occupation-focused. Strategies that OTs may utilize in hand therapy could include identifying barriers to completing occupations due to hand injuries, incorporating occupation-based models such as CMOP-E, coupling occupations with orthotic interventions, therapeutic exercise, PAMs, and more, attending and contributing to professional development and continuing education, educating students to learn new ideas, create dialogue about occupation, reframe activities to be occupation-based, be current in research and occupation-based practices, use AOTA's occupational profile template, use the occupation-centered intervention assessment, use CPT billing codes, and advocate to employees, employers, state, and national level organizations. Now we are going to apply this information to a case example of a client who will come into your clinic. Larry is a 61-year-old male and presents post-op double trigger finger release and carpal tunnel release in his dominant hand, which impacts his fine motor and grip strength. Upon occupation-based evaluation, it was found that he lives with his wife and he enjoys gardening and frequent walks. He currently experiences difficulties completing his gardening and self-care tasks, such as brushing his teeth. Barriers were identified in his home, including heavy cabinet doors and dishes stored high in the kitchen. Based off this information, think of ways to develop an occupation-based intervention for Larry. If you would like, you could pause the video while you come up with your ideas. Your ideas might look different than what we came up with, but this is one example of how OBP could be applied with Larry. To start, we would use heat to increase circulation, reduce pain, and improve joint mobility within his hand. During this 5 to 10 minute PAM unit, we will educate Larry on joint protection strategies and recommend home modifications to help facilitate self-care, home management, cooking, and gardening tasks. Our session will then progress to stretching and manual therapy, including passive range of motion of the wrist and fingers, moving the wrist into flexion and extension, and radial and ulnar deviation. Each movement will be held for 30 seconds to a minute to stretch the muscles. Then we would move to the two fingers affected by the trigger release. Passively move these fingers into flexion and extension at the MP, PIP, and DIP joints. After this passive range of motion, we will do these movements again and hold for 30 seconds to a minute to stretch them out. We will provide joint distraction at the wrist and the IP joints of the affected fingers. Next, we will do some preparatory activities to work on fine motor and grip strength, such as a pegboard, using tweezers and pom-poms, and a pony bead pickup activity. After all of this has been completed, we will move into our occupation-based intervention. This could include a gardening task, brushing his teeth, or doing dishes. We chose to focus on a gardening task. This activity is working on grip strength in a meaningful functional occupation for the client. Have the client grasp the hand of the shovel and work on scooping out the needed dirt into a pot. After the dirt is placed into the pot, have the client open the seed pack using a 3-jaw chuck grasp, and then have the client dump the seeds into a plate, picking them up one by one, focusing on fine motor and pinch strength, and placing them into the dirt. After the seeds are placed in, have the client scoop a little more dirt into the pot to cover the seeds. Then you could have the client grab the watering can and walk to the sink to fill it up, walking back to the table holding the filled up watering can, focusing on gripping the handle appropriately, and then have them water the seeds. During this, ensure that the client is controlling the pour and gripping the can strong enough. Throughout this activity, the therapist can educate on proper joint protection strategies specific to gardening. So as you can see, using a meaningful occupational Larry can still address aspects of hand functioning, such as grip strength, pinch strength, and fine motor skills to achieve his goals.
Thank you so much for your attention and time to our presentation. If you wouldn't mind, please fill out this brief survey on the QR code, or it will be included in the email. And here are the references.